It's mentioned over and over again that the promise of equitable access to convenient, patient-centered primary care is a promise only offered to those who are insured in our province. But we know that there are hundreds of thousands of people in Ontario who are uninsured and have no access to primary care or other health services. And many of those who are uninsured are newcomers or migrants in Canada who we know face additional barriers to accessing care when they need it. And when we don't provide health coverage, we know what happens. People are unable to access early preventative or interventional care, and we end up seeing them in hospital only when they're critically ill and needing much more expensive services. Or our healthcare providers in our hospitals are put in the terrible position of handing a sick person a bill and seeing if they can get it paid. And often those bills aren't able to be paid, leaving our healthcare providers in our hospitals losing money for services rendered. In 2020, our province implemented the Temporary Physician and Hospital Services for Uninsured Persons program. And I'll give a compliment when a compliment is due. I think that was a very good program, and that was a great step. This was part of our pandemic response and allowed physicians and hospitals to directly bill the government for uninsured services offered to people who lacked coverage. The temporary funding for uninsured persons was in place until March 2023, and over those 3 years, 7,000 physicians billed 400,000 services under the program, costing only $15 million. For $5 million a year, we were able to address a gap in uninsured services that we have been struggling with for decades. It was so cost-effective. And $5 million a year is just 8% of what Shoppers Drug Mart billed us for med checks last year. And somehow we're able to find that money. It's staggering to think that our government would consider that a more worthy investment than ensuring health for all and offering access to health care for every single person in our province. We need a true universal health system, and reinstating funding for physician and hospital services for uninsured persons would be a substantial and commendable step in realizing that promise.